Good morning, everyone. We will now call the Committee of Family, Seniors, and Health to order. Mr. Secretary, please call the roll.
Senator Carter.
Here.
Senator Nicola.
Here.
Senator Lewis. Senator Moon. Senator Hudson.
Here.
Senator Nirenburn.
There she is.
Quorum is established.
All right. With quorum established, we are going to go into, we have a bill to accept.
149 was your first one.
Okay. We're going to go into executive session. Do I have a second?
It's not exec session.
We're not executing on that?
149?
Mm-hmm.
I thought that was its first hearing for 149.
No, I asked it.
You're not ready to accept on 149.
Yes.
No, which one are we executing on?
You're executing on 66.
Yes.
Okay.
Yes.
Gotcha.
Okay, 66.
Yes. Sorry.
We are executing on 66. So, when you're ready. Did we get a second on the executive section? Thank you. All those in favor?
Aye.
Do I call the roll?
We're now in executive session, and
Just move to bring up Senate Bill 66 before the committee.
okay, we're going to move to bring up Bill 66 before the committee. Are there any questions? Do I have a second?
Second.
Thank you. All right. Call the roll.
Okay.
You got to call roll.
Okay.
It's voice vote.
Okay.
So then you just explain the bill and then you make a motion to pass.
Okay. Is that right here?
So
Okay.
you can move to do pass, get a second, and then discuss it. Call roll, announce roll.
Okay, we're 66. Okay, so we're going to backtrack just a little bit on this. We have a second. I just want to discuss it for just a second and remind you that this is the marriage licensing. They're lowering or raising the minimum age to 18. So, any discussion on that? 66. This is the marriage bill. Mike, thanks. Any other discussion? Seeing none?
So make your motion to do pass.
Okay. I move to vote the bill do pass. Go ahead and,
Do I have a second?
do I have a second?
Second.
Thank you.
Now call roll.
Okay, now call the roll. Okay.
Senator Carter.
Yes.
Senator Nicola.
Yes.
Senator Lewis.
Yes.
Senator Hudson.
Yes.
Senator Moon.
Yes.
Senator Nirenburn.
Awesome. Thank you. With a vote of
69.
unanimous,
Yep.
6-0, the bill passes. Okay, all right,
You can leave exec session. if you want.
okay.
Make a motion and get a second to leave exec session.
Okay, I make a motion to leave executive session. Do I have a second?
Second.
All right, thank you.
Now you're back in committee.
Okay, thank you. All right, that was a fun exercise, everyone. Thank you for your patience this morning. 8 o'clock is early. Did everybody get coffee? You good? It's also Wednesday, so there you go. We're going to go ahead and get rolling with our other bills. So we're going to, do I need to do anything else?
Call your first bill. and
Okay,
start the
so,
bill.
all right. Which we're starting with
149.
41.
149.
149 will be our first bill to hear today. Is that ours?
That's yours. Yes.
That's fine. Thought it sounded familiar. All right, thank you. So Joe, if you wouldn't mind. You're the best.
Senator, can I grab that blue pen from you? Can I grab that blue pen from you? Thank you.
So where are we at in this, man?
So this should just be normal presentation. She should be able to present her bill, and then we'll call pros and cons from there. Yep.
Good morning, members of the committee. It's I appreciate your time in hearing this bill. Senate Bill 149 proposes to update Missouri's food labeling laws. Here's a summary of key changes and provisions. This basically increases media protection. Media outlets that run false ads aren't liable unless they refuse to provide the state with advertisers' information when requested. It does implement new labeling requirements. Standardizing front of package labeling requires clear front-facing labels to help consumers easily identify products with high sodium, added sugars, calories, or saturated fats. It does have allergen and caffeine disclosures, common allergens, gluten-containing grains, and caffeine levels over 10 milligrams per serving. It also has ingredient transparency. Products featuring fruits, vegetables, and whole grains in marketing must disclose the actual percentage of those ingredients on the label. And it is stricter than current federal rules. There are some misbranding rules in section 196.075. A food product will be considered misbranded if it fails to meet the following requirements: false or misleading labels, imitation products, ingredient listings. Products must list ingredients clearly unless exempt, spices grouped together, things like that nature. Special dietary uses, products marketing for specific health and dietary reasons must disclose relevant nutritional information. There's also a component with new labeling disclosures, including bioengineered or GMO ingredients must provide a QR code or website link identifying the bioengineered substances. Coated fruits and vegetables must disclose if products have an edible coating like wax, either on the label or at the point of sale. Lab-grown or insect-based foods requires bold labels, at least 15-point font, stating lab-created or insect-based. mRNA vaccinated meats, products from animals vaccinated with mRNA vaccines must be labeled mRNA vaccinated in bold type. There are some exemptions. Small produce containers exempt small open containers of fresh produce from certain labeling requirements, and there's also an exemption for bulk processing. So the key takeaways to this legislation is the bill aims to increase transparency in food labeling, particularly for products involving biotechnology, allergens, lab-grown ingredients, and dietary health claims. It empowers Missouri to set stricter standards than federal regulations when needed. Consumer transparency builds trust and drives sales. Trust is an investment. Clear, honest labeling increases consumer confidence. When customers feel informed, they're more likely to remain loyal, potentially increasing sales and offsetting any minor cost increases. Market trends favor transparency. Consumers increasingly demand to know what's in their food. Whether it's allergens, additives, or how it's produced, meeting this demand can be a competitive advantage, not a burden. Right now, companies can use deceptive marketing like exaggerated claims about whole grains or natural ingredients to outcompete honest producers. This bill ensures that companies making genuine products aren't undercut by misleading labels. This bill also helps support Missouri farmers. Transparent labeling can actually benefit local farmers who grow real natural products. Consumers may prefer Missouri-raised meat over lab-grown alternatives when they know what they're buying. There is a hidden cost to poor nutrition. Inadequate labeling contributes to health issues like obesity, diabetes, and food allergies, which drive up healthcare costs for everyone. Clear labeling helps consumers make healthier choices, reducing long-term medical expenses, costs that far outweigh any short-term expense to business. This bill isn't about punishing or pushing them. It's about protecting consumers, supporting honest farmers, and ensuring Missouri remains a leader in food integrity. The real cost isn't imprinting new labels or having QR codes. With this information, it's about failing the people and not giving them access to the information to help them make informed decisions. And with that, I'll take any questions.
Thank you, Senator, and thank you for bringing this bill to our attention. Is there any questions from the committee for the Senator? Senator Moon.
Good morning, Senator. Thank you for the explanation. One of the questions I have is, will this include when a farmer produces a particular product and sells it directly to a customer? Will there be labeling requirements on those products?
Let me make sure, let me check on that, but I do think that it is about basically those big manufacturers that have them in the store. I can get more clarity on that.
Thank you.
Yeah.
In addition, tell us from your experience and maybe from feedback from others, why it's important that we have clear labels on what's in the food.
Well, Senator, you've been a proponent of some of the food labeling laws, changing and going back to some of our food labeling, I think in particular our meat. I think right now we're seeing an uptick in a lot of diseases, a lot of mental health pressures that are being put on our society. And a lot of this we're seeing at the federal level, thank heavens, some nod to some changes that will help us to be better consumers. It's interesting to me that I have a son who has a lot of special needs. And it was very difficult for me, especially when he was younger. I mean, he's almost 30 now. But it was very difficult for me to be able to go to the store and be able to, when it says natural ingredients or it has some of these other additives that really they don't have to disclose, it made it very difficult for me to make sure that whatever he was eating wouldn't exacerbate his issues. And to be able to go to Europe and spend time in Europe, where there isn't a lot of the additives that are in the same foods that we have in America, same brand, same product, but the labeling is much clearer. The idea is not to ban these products or ban the companies from using the products, but to just have transparency in the labeling so that we can make better informed decisions.
Any other questions from the committee? Seeing none, we'll move on to public testimony. We'll start with those who are in favor. How many do we have here that are in favor of this bill that would like to give testimony? One? Okay, we'll go ahead and move with in favor.
My name is Bev Aylen. I'm the president of Liberty Link, Missouri. Oh, thank you. And I just want to go on record in favor of this truth in labeling bill. I'm here as a volunteer, and I'm not a paid lobbyist, and I'm just here for truth in labeling, and I think everybody benefits when they know what they're buying.
That's great. Thank you very much. Any questions for the witness? Seeing none, thank you very much. Anybody else here that wants to speak in favor of this bill?
Don't be shy.
Okay, opposed? How many do we have here that might want to speak in opposed? Okay, all right. Go ahead and next person, just come on up.
This is how you get to see your friends.
I have the pleasure of going first. So, Katie Gamble here on behalf of the Missouri Beverage Association. I want to first thank the sponsor. We met with her yesterday, and I appreciate the continued dialogue on this. I will say there's several provisions in the bill. The two pieces we're primarily concerned about is the front of package labeling, and that really relates back to federal regulations and wanting to make sure that when we're sending our beverages, we bought a lot of beverages in Missouri and send them out of the state. We have a lot of products coming into the state, and we just want to make sure that laws across the states are similar and the same. If you start having to have a bunch of different items on labels, our beverage labels aren't terribly large, and so if you get 50 different states with 50 different labeling requirements, that becomes a little complicated. The federal government also, the FDA, released a draft front of package label proposal, I think at the very beginning of January. And so they're working on kind of updating those requirements anyway, and we'd like to see what those look like. I think that normally in a past administration, they might scrap previous rules, but I think that if RFK Jr. comes in, which it looks like he's probably going to, that is going to be something of interest that they're going to continue to work on, and so we would just like to see consistency across the states. And then the second piece, again, is the QR code link piece about having ingredients. It goes back to just wanting to make sure that our labels can be consistent across all of the states, and we don't have to have specific labels for Missouri and a different one for Kansas and a different one from Arkansas and a different one for Nevada, because that just makes interstate commerce complicated. And so those are our primary concerns with the legislation. Happy to take any questions.
Thank you very much for your, appreciate that. Any questions for the witness? Okay, sure. Senator Mann?
Thanks for your testimony. I'm just wondering, for clarity of ingredients, would it be, and I'm not sure exactly which terminology to use, because sometimes when you get into the scientific names of it, they can be long and broad, and I know that can get pretty big. But for sake of safety and clarity for those who are going to consume that, and the sponsor mentioned about having special needs and special diets requirements, that would be important to them. So if they were wanting to consume your product, how could it be listed so that they could be assured of the safety of ingesting it, and maybe even across all 50 states? Is that possible?
I think that's a really good question. I think the sponsor's trying to tackle that by like having a link or something. So when you talk about really long, detailed names of different ingredients and such, but I think it's a good question. And again, my biggest concern, it's less about making sure we want to make sure consumers know what's in the products and are happy with the products, because otherwise they're not purchasing the products, which is obviously a concern to us. So the biggest thing on our end is just we want to make sure that however we do that, it's done across the country. So we try to be a leader in making changes, and so hopefully we'll be able to come to some solution.
Yeah. And then with the QR code provision, would that not be a happy medium where you could have the QR code that would link you to a full description of anything and everything, and you wouldn't have to, you could just limit that to a small spot on the product? Would that be a solution?
Well, I think the challenge is if we have a QR code and Kansas requires all the list of labels and Arkansas comes up with a different way of doing it, I think that's the challenge, less than being opposed to specifically a QR code.
Okay. All righty. Thank you.
Any other questions for the witness here on the committee? Seeing none, thank you very much. Appreciate it.
Thank you.
Next in opposition, please. And just to remind everybody to have a witness form, please, and just leave it up here on the table.
Yes, Mr. Chairman, my name is David Overfelt. I'm the president of the Missouri Retailers Association, a lobbyist for the Missouri Grocers Association, and a lobbyist for Associated Industry of Missouri. And of course, all groups are opposed to this current bill. I have to say this, I have to commend the soft drink industry because they are leaders in this fight, and they do a lot to try to get the proper information out to their consumers. Again, interstate commerce, having to have different rules for every single, could happen in every state. We need consistency and uniformity, and that needs to be done at the national level. QR codes are a great potential, but we feel they need to be done at the federal level. We want to make sure that the people understand what they have, what they're buying. I look at labels constantly. I've learned a lot from that. But again, we need uniformity, and we will comply and work with the current federal administration to try to address a lot of issues that the senator currently has.
Thank you. Is there any questions for the witness? Yeah. Okay, seeing none, thank you very much. Appreciate it. Next in opposition.
I filed online.
Okay,
I don't remember.
perfect, thank you. Do you have a receipt for it? Can you show us? I'm just kidding.
It did send me something.
I'm just teasing. Next in opposition.
I'd be up here.
You can just make an appointment with the office. We don't have to meet with us.
I tried you. I came by at 6. Nobody was in there.
Mr. Chairman, Shannon Cooper today representing the Missouri Cattlemen's Association. I go on record in opposition, just a couple of points that create great anxiety for our members. And I'd like to point out that several years ago with help of Senator Crawford, we were the first state in the nation to actually pass legislation to make it clear when you bought a package of meat, it was either real meat or some other type of lab-grown or fake plant-based meat. We were in court 3.5 years over that. Finally, the courts ruled in our favor. So we have always been a proponent of fair labeling. We got many members that choose to produce and market their own beef. They provide labeling, which they feel like gives them a competitive advantage so that individuals such as Senator Carter can know, hey, if I bought this from Cooper's Happy Farms, here's exactly what has happened with that animal in their lifespan. The penalties really make us nervous. If you would follow the food chain and look at the penalties for each occurrence, I could see this being a trial lawyer's dream come true when they would try and trace back some of these products that ultimately would end up at my farm and say, hey, you're ultimately responsible for 10,000 packages of meat because you raised that animal and the person that purchased it and then put it out there for sale did not comply with Missouri law. So those are issues that make us nervous. As always, we're willing to work with the sponsor to see if we can come up with some type of truth in labeling, so to speak, that is not cumbersome for us or does not create a situation that puts our producers at a great disadvantage. Be happy to answer any questions.
Thank you very much. Is there any questions for the witness from the committee? No, seeing none. Thank you very
Thank you,
much.
Mr. Chairman.
Appreciate it. Next in opposition.
Thank you. They all smile when they walk past.
Morning, Chairman. Scott Hayes from the Missouri Pork Association. I thought we'd get all the meat guys down here at once. So I'm here to speak in opposition, but wanted to bring maybe a little bit of information to this as well. I just chaired a task force on traceability in the pig industry. USDA has that traceability plan that they're studying now, and will come out with rules on that. So, but what I'd like for you to understand is when we raise pigs, and most of those pigs, if they're vaccinated, would be vaccinated at a very young age. And those pigs could be dispersed across the industry. In fact, we export a little over 3 million pigs at about 12 to 15 pounds out of Missouri every year to go to different farms to be fed. So if you think about a traceability on a vaccine on a pig that's 3 or 4 weeks old, we're going to harvest that pig at 6 months. He may hit a couple of different farms. In the meantime, go to a processing plant, be processed, and then that meat dispersed out lots of different ways. And I can tell you there is a couple of modern plants that can trace meat, whole cuts, back to a particular farm, but no one in the industry can trace back meat that's been processed, blended. So if you think about sausage or any products like that, pepperoni, there's no way to trace that back to a particular farm, to a particular pig. So I'm not sure how the processors would label meat coming into Missouri when we would have to disclose vaccine that was administered months before on a different farm than it was raised on. I think you would end up with packages that just say may contain. And what does that tell us? I don't think that clarifies. I think that adds to the confusion and certainly makes it harder to do business in Missouri. So that's why we would be in opposition. It's going to add cost to the system and really not tell us anything. And ultimately, the producers are going to bear the brunt of that cost.
Well, thank you for your testimony, and thanks for talking about all this food, because now I'm very hungry. And when you mentioned pepperoni, that just put me over
He
the
never
edge.
said bacon.
Yeah, that's true. Well, thank you. Is there any questions for the witness? Seeing none, thank you very much. Appreciate it. Next in opposition.
What, are you handing out information?
While we're on the meat category, I thought I'd take this opportunity because I want to talk about the mRNA provisions in the bill. My name is Kelly Gillespie. I serve as Executive Director of the Missouri Biotechnology Association, and yes, you do.
Thank you.
And I'll provide any more for anyone else that wants some. But I wanted to also speed things up because some of the details can get pretty detailed, and you guys don't need to be taken back to to biology class or school in that regard. We're all here today and together because we do support transparency. We do support better health outcomes for humankind and a safe food supply. That unites all of us. These are not brand new issues. These are ones that policymakers across the country and in the nation's capital have struggled with for years and decades. In terms of messenger RNA labeling with food products, there is no commercial product yet approved by USDA or FDA on the market. So really, our approach is why challenge a technology platform for what possibly bad could happen when we don't have any proof that anything has happened yet. The steps that mRNA would have to go through, the most promising territory is in provisions that might prevent an African swine fever in the future or some other disease states that threatens pork producers over time that we don't even know about yet. But we wanted to express concern about that. There have been RNA vaccines that are on the market, and specifically for the pork industry, and they're used and they're effective and they're important. Additionally, my other main focus in my testimony this morning was in relation to the bioengineered elements of what goes into food. And so that hits our row crop farmers squarely in the face because, you know, now 65% of corn, 90% of soybeans have some type of genetic modification to make them plant resistant and make them drought resistant or do other things that actually reduce the amount of chemicals that are needed for these plants to grow, thrive, and not be weed infested. Biotechnology offers many of those environmental benefits and health benefits, and that's why the federal government and the states struggle with it for so long. I've been with Mobile for 20 years. I was on food labeling issues primarily with Congress for over 10 years before it passed in 2016, signed into law, promulgated. This is not everything that's in Senator Carter's bill, but in that specific area of bioengineered foods, federal law was passed in 2016. It preempted the states. They absolutely said, we do not want a patchwork of regulations state by state. A state like Missouri with 7 or 8 border states and so many people live on borders and the cross traffic for interstate commerce. So much of what we get from Northwest Arkansas and the poultry industry and other things like that, it would place large burdens on that zone. I'll happy to answer any questions. Senator Moon, you asked a question about QR codes, and inside that bioengineered, the National Bioengineered Food Disclosure Standard, if you look at the 4th page down at the bottom, they talk about not only QR codes, but text messages, fonts of different sizes. The federal government, in that combination of USDA, FDA, and EPA, when they came to that standard, they wanted to make sure that they provided as many options as possible. So as you write your legislation, make sure that you're trying to at least be consistent in giving as many options as possible that are relevant. And so I point you that. I'll be happy to provide any further information that I can dig out from other resources, state or national. But again, biotechnology and life sciences and research and how it's used in the state of Missouri, it's an economic driver. It's a real important element, and we want to get it right, and we applaud you for having any concerns at any time. Let's work towards them and want to be supportive of this public policy process.
Thank you for your testimony. I'll just make a comment. I'm extremely concerned about our food supply, what's in it, what's going in our animals, what's going in our these bioengineered foods. So I'll take a serious look at some of these things. And I think, just giving my opinion, we need to make the people, our consumers, as well informed as possible of what they're ingesting, because it's an extremely important issue. Any questions for the witness from the committee? Thank you very much. Seeing none, appreciate it.
I agree with you. Thank you.
Any more here in opposition?
Good morning, Mr. Chairman, members of the committee. Mark Figgenbaum with Missouri Farm Bureau testifying against SB 149. Currently, the food industry is highly regulated at the federal level, and we believe that increasing the regulatory patchwork in the state of Missouri may potentially dissuade food producers in our state. And that concludes my testimony.
Thank you for your testimony. Any questions for the witness? Senator Moon?
Thank you for coming forward today. I just had a thought as you ended your statement there about dissuading food producers. I'm a small-scale producer, and I've chosen to have no additional inputs that would be bioengineered, but non-GMO is what I use for finishing cattle. So I wonder, and again, I'm not looking from a large scale necessarily, so I can imagine that the expenses are going to be different for others. But would that not maybe push people toward simpler is better?
I think that having a choice in how you would want to label, like if you want to have low input into your production and you would like to market that voluntarily, that'd be a wonderful option. But what we're trying to avoid is increasing regulation and liability for other producers who prefer not to.
Any other questions? Seeing none, thank you very much. Appreciate it. Anybody else here in opposition to SB 149?
Good morning, Michael Henderson on behalf of Consumer Healthcare Products Association. A number of our members produce dietary supplements, which in this country are regulated as food. There are some concerns with the labeling requirements here. I was supposed to be receiving a letter from my client later this afternoon, and once I receive that with some of their more detailed concerns, I'm happy to share that with the committee and with the bill sponsor.
Thank you very much for your testimony. Any questions for the witness? Seeing none.
Thank you.
Thank you very much. Guess I don't need to say it. You're here.
All right, good morning, Mr. Chairman, members of the committee. Ben Travis on behalf of the Missouri Soybean Association would like to go on record in opposition to this legislation. I do want to say that we do sincerely appreciate the senator's desire to have healthy foods out there in our system. At the end of the day, that's exactly what our farmers want as well. And I can tell you as a new father, I also am looking at food labels and scrutinizing them more now that we have a 9-month-old son. But at the end of the day, the reason we're in opposition today is due to the cost implications. You know, due to the realities of our economy and the market realities, the cost will eventually be put down onto our producers. And that's the reason that we are in opposition today, just due to those tight margins that our farmers are enduring, especially with the uncertainties on the international scale right now. And so with that, there very well may be a need for this conversation to happen at the federal level, and we will be happy to engage in those conversations when those occur, but we do believe that it should happen at the federal level. So with that, be happy to answer any questions.
Thank you very much for your testimony. Any questions for the witness? Seeing none, thank you very much. Y'all are just saving me words. Perfect. You're just saving me words, coming one at a time.
Done it a time or two before. But one second. Mr. Chairman, members of the committee, my name is Jacob Knabel with Missouri Corn Growers Association. We also would like to go on the record in opposition to Senate Bill 149. Again, I'd like to applaud the sponsor. I do believe she's not attempting to outright ban bioengineered crops or anything like that, as she's already previously stated, so I don't need to go down the rabbit hole of all the benefits to genetically modified technology for the American farmer today. However, we do have some concerns, like Missouri Soybean Association, with the cost compliance aspect of this bill. By creating a patchwork of state-specific labels, we are concerned about added cost to the food supply system that ultimately ends up getting passed down to either the end consumer or the initial producer of those products. And so, for those reasons, Missouri corn growers are in opposition today. Any questions?
Thank you very much. Any questions for the witness? Seeing none, thank you very much. Appreciate it.
Good morning, Mr. Chair, members of the committee. Jared Hankinson with the Missouri Chamber of Commerce, here to speak in opposition to the bill today. Will not belabor any of the points that you've already heard. We'll just emphasize. We have heard from Missouri Chamber of Commerce members the increased compliance costs are something they would like to avoid. They would like to avoid passing additional costs on to consumers. And then something that was mentioned earlier once, I believe, the potential liability is something that some of our members would like to avoid as well. So again, won't belabor the point, but I'm happy to take any questions.
Thank you very much. Any questions for the witness? Seeing none, thank you.
Thank you very
Appreciate
much.
it. Anybody else here in opposition to SB 149? Anybody else? Okay, anybody would like to speak for informational purposes only?
Thank you, Senator. Good morning, Mr. Chairman, members of the committee. My name is John Barget. I'm here appearing as a registered lobbyist for Anheuser-Busch, and I want to thank the sponsor for meeting with us to discuss our one area that we want to bring to attention. We also met with Senator Schroer, who has a very similar bill, and he agreed with this, Senator Carter. The Federal Alcoholic Beverage Labeling Act prohibits states from imposing additional restrictions on alcoholic beverages on their labeling. We wanted to bring that to your attention. We have provided that information to the Senator's office as well. Currently, my client, Anheuser-Busch, and I think most of our competitors, provide links and/or QR codes to the ingredients which are found in those. And so we respectfully just want to bring that to everyone's attention.
Thank you very much. Appreciate it.
Thank you, Senator.
Anybody else would like to speak for informational purposes only? Okay, seeing none. Senator Carter.
Just thank you for your time in hearing this legislation. I do think that our food, it impacts more of our lives than sometimes we give it credit to, and have given it not the attention. It really needs more attention, and it hasn't been given the attention that it needs. I'm happy to work with those stakeholders here in this room on trying to make this a better bill. So thank you for your time.
Thank you, Senator, very much. This will conclude the hearing on SB 149.
Thank you. I got it.
Just weird me out. I'm sure.
Senator Lewis, we are moving it to hear your bill, Senate Bill 94. Just begin when you're ready.
Good morning, Madam Chair, distinguished members of the committee. My name is Patty Lewis, and I represent Senate District 7 in Kansas City. Thank you so much for the opportunity to present Senate Bill 94, which seeks to protect access to telehealth services for Missourians. The bill has a zero fiscal impact. It is non-controversial, and I would like this bill to be voted out consent should the committee deem it appropriate. The demand for telehealth services has grown in Missouri, and more people are using the services than ever before. Many Missourians lack internet access, and many elderly do not own smartphones or computers. Therefore, telehealth, especially audio-only options, have become a preferred choice among rural and elderly Missourians. So what does Senate Bill 94 do? It cleans up language around telehealth services and does two things. Number one, it protects telehealth services which have been in place since the pandemic with audio, visual, and audio-only options, ensuring that insurance cannot deny coverage. Approximately 20 states have passed laws protecting audio only, including surrounding states like Kentucky and Iowa. The second thing the bill does is allows healthcare providers to select the telehealth platform as long as it's HIPAA compliant, ensuring that insurance cannot mandate what a provider can or cannot choose. Similar states like Oklahoma and Kentucky have adopted similar language. This bill has a history of bipartisan support. Last year, Representative Mike Stevens and I had a hearing in the Health and Mental Health Committee. It was voted out unanimously, 13-0. Last year in this committee, Senator Arthur carried the bill and it passed out 6-0. Both hearings, there were no witnesses in opposition. And just yesterday in the House, the bill was heard, sponsored by a Republican and Democrat, and to my knowledge, there was no opposition in testimony yesterday. So thank you so much for the consideration, and just to recap, this protects telehealth services that have been in place for over 5 years. It is proactive to ensure that if private insurance companies decide they want to reduce or deny reimbursement, our constituents would be protected. So with that, happy to take any questions.
Thank you. Any questions for the senator? Senator Moon?
Good morning, Senator.
Good morning.
As I was listening to you, and I'm familiar with, I think we've dealt with something similar in the past too, as you mentioned. I've had some experience with telehealth in its beginnings, probably 35 or so years ago, when they were primarily doing it with monitoring patients who were recovering from heart surgery and things of that sort. But with all the technological changes today, depending upon what the consult is for, would you not need some visual presentations as well? And so explain that, and I may have another question for you after that.
Yeah, sure. So what this does is, I think in-person visits are the ideal, the norm, but sometimes that's not feasible with, the shortage of healthcare providers and, folks having to travel several, hours to go see a primary care. So this is just protecting telehealth services as it exists and has been in place with audio visual. That's like a Zoom, if you will, but sometimes with the unreliable internet access that we have in rural communities, even where I am in urban, in Kansas City, sometimes my Zoom or whatever internet goes out. So we just want to ensure that the patient can continue the visit with just the telephone option should the internet not be an option.
That part gives me a little bit of hesitation because, for example, I mentioned the access through monitoring heart rates for people who are recovering. If a patient presented themselves via a Zoom call, audio only, let's say, and they were experiencing some angina and their facial appearance would indicate that they may have hypoxia, and the doctor can't tell based on what they're saying what he might or she might want to do. That would be concerning, I think. And even if they had the visual, sometimes the resolution isn't going to show what the true appearance may be like. And so I wonder if that's the case, who would assume the risk of that particular liability? I like telehealth. I think, though, there are risks involved, and I understand that it makes it easier on all of us sometimes, especially if you're not able to travel. but there are risks as well. So tell me, explain to me if I'm off base there, because I very well could be, and tell me how I might be able to come back more toward the center.
Well, I appreciate your concern, and I think that in like an emergent situation, there's no stopping like calling 911, or if you were in a clinic, an outpatient clinic, and were seeing your primary care and had angina or became cyanotic or something, they would not be equipped to handle an emergency situation. Have to transport you to an inpatient or an ER situation where they could comply with that. So, I understand what you're saying, and I don't know if some of my witnesses behind me can address some of your concerns, but I do want to emphasize that the audio only and the audio visual components have been in practice for several years since the start of pandemic, and we haven't seen any increases in I guess I don't know what I'm trying to say, any risks associated with the practice.
And that's where I may have stepped off the roadway a little bit when I heard audio only. But that would be acceptable too. The audio only would be, I guess it's acceptable now and would continue to be.
Yes.
Okay.
Yeah.
I'll have to think about that some more, and maybe we can have some conversations about it, because I'm favorable of it.
Yeah.
I just want to make sure that we've got all the bases covered and that we're not doing something we really shouldn't be.
Absolutely, and I really appreciate that. We don't want to have any unintended consequences. So
Certainly.
happy to speak offline. And, again, it's just, I can't emphasize enough. We've been doing this for several years. Haven't seen any increase in risk. Just want to protect what our constituents are used to today.
Thank you.
Thank you.
Any other questions for the senator? Seeing none, we'll go ahead and open up comments to the public. First in favor.
Thank you, Senator Lewis, and also thank you and good morning to Chairperson Carter and members of the committee. My name is Dr. Amy Beck. I am a licensed psychologist, and so I am here on behalf of myself as well as the Missouri Psychological Association. And I want to just reiterate again that this is really just a simple cleanup bill. We already have legislation that covers telehealth in terms of medical practice, prescribing, et cetera. And so that is already an excellent statute. This is really just closing what is a language loophole in that bill to cover audio only, which again, we have already been utilizing since the pandemic. And so the reason why we are even here to close this loophole is because audio only is covered by Medicare and Missouri Medicaid, but it is not currently covered, it is covered, but it's not required to be covered by private insurance. So they are currently paying for it now, equal the rate of telehealth and in-person visits. But what we don't want is the wind to blow in a different direction and private insurance to decide that they don't want to pay the money to cover what is a well-utilized and beneficial service for many residents of the state of Missouri. That's what we're trying to do, is protect patients and providers from being bullied by private insurance. And so what that bullying would look like if we were to lose access to this service, Missouri has the fifth worst broadband service in the country. And many residents in rural areas don't even have internet access. And there are also many barriers to in-person care as well. And so audio only is not an overutilized service. It really is the option that is the stopgap between no care at all. And that's what we're talking about. And when you think about sort of the liability question, Senator Moon, that you were bringing up, when there's already a lot of liability in healthcare anywhere, that risk is just sort of assumed as a provider, such as myself, and that is something we're trained to manage. And when you think about how the phone is already utilized outside of even just doctor-patient appointments, but 988 suicidal patients or 911 for patients having any number of medical emergencies, people who are answering the phone are trained to assess and direct. And so if there's any concern that that could be an emergency, providers, we tend to overreact because we don't like liability. And so it's, go to the emergency room. I'm not sure with what you're describing, what I'm seeing or what I'm hearing. So please, make all efforts to get yourself to an in-person appointment to be seen, like the emergency room particularly. And so, and as to what Senator Lewis was talking about, we have been utilizing audio-only telehealth since the pandemic, and there hasn't been any increase in concerns regarding how patients are handled and treated and their outcomes. And then one other point that I would like to add too, just for my own personal practice, I use audio only the most as a backup to when I'm using audio-visual telehealth. I am fortunate to have good broadband service, but when we have inclement weather, like the snowstorm a couple of weeks ago, even my Google Fiber lost the capacity to carry video. And so I had to turn cameras off to continue my therapy appointments with my patients. And so that became audio only, even though I started off and intended to do audio visual. And so again, having this protection by private insurance would mean that I would continue to be able to be paid for the service and treatment that I'm providing, as well as patients would also know that they continue to have access as well. So again, asking support, voting to pass for SB94 to preserve what we already have and not disrupt what is a really beneficial mechanism of care for so many across the state. Thank you.
All right, any questions for the witness? Seeing none, thank you for your testimony, and thank you for wearing those nice earrings.
Thank you. Go Chiefs.
All right, next in favor? How are we doing? Oh, gosh. Okay. Yeah, okay.
Thank you, Madam Chair, members of the committee. Justin Alferman representing SSM Health. At SSM, we are always going to be in favor of anything that grants access to additional telehealth services. This type of bill I like to refer to as belts and suspenders. We already are allowed to use audio-only telehealth in the state of Missouri, but this is just another added protection to make sure that that is a practice that continues in the state of Missouri, but also the online platform that and not being dictated by the insurance provider, making sure that the payers don't dictate who or what type of platform is used is very important. I want to comment on Senator Moon's comments. Telehealth is not appropriate for every standard of care. In fact, the only way you can use telehealth is if that standard of care is appropriate for that type. So a perfect example of this is dermatology. Not appropriate for telehealth to use over audio only because obviously you can't see the patient. At SSM, currently in the state of Missouri, we have a platform where if you do choose an audio only, we have the option that if you are getting an audio only visit, you have the ability, the physician has the ability to bump that up to a video visit. Or potentially, if the video visit doesn't work, we have an option to refer you to your local primary care physician if the standard of care cannot be met. So I believe most providers that offer telehealth services will have the ability or have built systems in place to elevate that standard of care if it cannot be met over telehealth standards. But this is a fantastic piece of legislation, and we urge the committee to vote to pass. Be happy to answer any questions.
Are there any questions for the witness? Seeing none, thank you for your testimony. Just a reminder to fill out a witness form and leave it on the desk there if you haven't. Is there anybody here to testify against the bill? Okay, that makes it easy. Were you here to testify against the bill? Okay.
Madam Chair, members of the committee, Jacob Scott, registered lobbyist for the Missouri State Medical Association and the Missouri Association of Osteopathic Physicians and Surgeons, here on record in support. It's such a great bill, I had to read it twice, so I hope this is the first of many bills we support of Senator Lewis. And Missouri physicians are excited about the idea of having these audio-only capabilities written into the law, and we look forward to working with you on many other issues in public health, and happy to take any questions from the committee.
Any questions for the witness? Seeing none, thank you for your testimony. Next, in favor?
Madam Chairman, members of the committee, Kaina Iman, on behalf of the Missouri Nurses Association, and yes, we are on the same page with Missouri State Medical Association on this bill. We appreciate Senator Lewis bringing this forward. We are very much in support of the bill and hope that you guys will support it.
Thank you. Any questions for the witness? Seeing none, you're free to go. Next. There's a
Madam Chair,
familiar
members of
face.
the committee, what?
I said there's a familiar face.
Yes, Jamie Murphy, registered lobbyist with the Missouri Hospital Association. I want to thank the senator for bringing the nurses and the doctors together, so good job. But we just wanted to go on record and voice our support. Happy to answer any questions.
Great, thank you. Any questions for the witness? Seeing none? Next.
Madam Chairwoman, members of the committee, I'm Kathy Harness, and I'm here today on behalf of St. Luke's Health System in Kansas City, as well as the National Council of State Boards of Nursing, and we want to go on record in support of Senate Bill 94 and thank the sponsor for this legislation.
Excellent. Any questions for the witness? Thank you.
Thank you.
Good morning, and thank you for taking the time to hear us this morning. My name is Dr. Michaela Muehlbach, and I am a Missouri psychologist as well. And I am here on behalf of Missouri Psychological Association, lovingly referred to as MOPA. And I am also very much in support of this. The practice that we have with so many people in Missouri, many people cannot afford smartphones. They don't have access to smartphones, and those that maybe do have those smartphones, that requires the internet usage that we heard earlier. I'm also reminded several times of different situations where we had patients that we were kind of working with, and they not only lost internet access, but maybe they were also in a situation or an environment where it wasn't necessarily safe or comfortable to have video on at that time. Some examples might be like domestic violence or situations where children or adolescents don't really want to have the video on or speak freely in front of their parents necessarily. And so being able to go into a different room and have a private conversation verbally was preferred for the patient. As you've also heard, this is also up to the provider. We certainly would not allow for anything to happen with our patients that we were not comfortable taking on the liability of that as well. So I'm happy to take questions as well. Everyone else said everything really well.
Any questions for the witness? Seeing none, thank you for your time.
Thank you.
Next in favor?
Good morning, members of the committee. Garrett Webb with the Missouri chapter of the American Academy of Pediatrics. Want to thank the sponsor for bringing this and all of you for hearing it. One thing just to note, a few weeks ago when we had the snowstorms, I had a pediatrician who had a patient that had a routine follow-up visit after a well-child visit that was supposed to be over video telehealth, but the child's parents ended up having internet connectivity issues, so they had to do the well-child visit over audio only, which was necessary, obviously, but also good to make sure that that plan of care was being followed. So it also affects kids in a good way.
Thank you for your testimony. Any questions for the witness? Thank you. Next in favor?
Good morning, Heidi Lucas, Missouri Rural Health Association. I'm the executive director, and this is a priority bill for our organization. This is a massive issue for our rural communities, especially with the lack of broadband. Almost 61% of rural Missourians do not have access to broadband, so this is really an access to care issue for our rural folks. So we are very much in support of it, and thank the senator for bringing it to the committee. Thank you so much.
Thank you. Any questions for the witness? Next.
Madam Chair, members of the committee, Derek Leffert, CEO of the Association of Missouri Nurse Practitioners, also want to go on record in support of the bill. I don't have any comments to add. Appreciate the sponsor and the committee's time.
Thank you for your testimony. Any questions for the witness?
Chair, members of the committee, Jessica Petrie-Telemaque here on behalf of BJC Healthcare, Cox Health, the Reach Healthcare Foundation, the National Association of Social Workers Missouri Chapter, Rankin Jordan Pediatric Bridge Hospital, and the Missouri Association of Rural Health Clinics. I really have to use my cheat sheet for that list. Clearly, organizations across the healthcare spectrum are really excited about this legislation for the rural health clinics, especially who serve some of the most underserved areas. During COVID, we had seniors who only had landlines, and this was a life-saving point of connection for patients. And so we think codifying this in law is an important step for patients and providers, and appreciate your consideration.
Thank you. Thank you for your testimony. Any questions? See none. Next.
Madam Chair, members of the committee, Will Mars on behalf of Mercy Health Systems, just want to go on record and support. This is going to increase patient access in rural areas, and we're very supportive of that.
Thank you. Any questions for the witness? Thank you. Next.
Madam Chairman and committee, thank you, Senator, for bringing this forward. I am here on behalf of Missouri Nurse Leader Association and MHA in support of this. Senator Moon, I wanted to address, you talked about monitoring heart rhythms on patients that were post cardiac surgery. That today is done without visual. It is done with a cardiac monitor, and I don't necessarily see those patients. So I think, as many has verbalized, it is about the right platform for the right patient and having the ability to do that. Thank you.
I'm sorry, could you please restate your name and who you represent?
Jessica Atchison, Missouri Nurse Leader Association and MHA.
Thank you. Any questions for the witness? Seeing none, thank you.
Thank you.
Anyone else here to testify in favor of the bill?
Michelle Tackett with the Missouri Nurse Leader Association, and as a parent, in support of the bill. I think I agree with everything that's been said so far, so I won't repeat any of it. But I do think, just as a nurse, we have to continue to look at different ways to provide access. It's a serious issue in the state and across the country. We trust our providers to make a decision on if it can be telehealth or not. I, as a parent, have been told, nope, you have to come into the clinic for that, just me trying to do it out of convenience. But second, I have a daughter with mental health struggles and medical struggles. There have been many times without the option of telehealth that she would not have been able to do her therapy visits. And when you have a 13-year-old that suffers with suicidal thoughts, like you can't miss those therapy visits. So, and you can imagine all of us on our Zoom meetings being told, you have to have the camera on, right? And none of us like that. So she does choose audio only because it is her comfort level. And you can imagine when adults aren't comfortable being on camera, a 13-year-old definitely isn't. But
thank you for your testimony. Yes. Any questions for the witness? Seeing none, thank you.
Thank you.
Next.
Good morning, Senator and members of the committee. Gerard Grimaldi with University Health in Kansas City, Missouri. I just want to echo the support of the bill. And thanks to Senator Lewis for sponsoring it.
Thank you. Any questions for the witness?
Senator Lewis is a former co-worker of mine.
Thank you, Madam Chair, members of the committee. My name is Megan Howerton here on behalf of Mosaic Life Care and Missouri Speech Language Hearing Association in support of the bill. Thank you.
Thank you. Thank you for your testimony. Any questions? Seeing none. Next.
Over everything. Madam Chair, Chairman, my name is Dallas Woods. I'm with the Missouri Organization of Nurse Leaders, just showing support for the bill.
Thank you. Any questions for the witness? Seeing none. Thank you. Any others here to testify in favor of the bill? Seeing no more public testimony, any closing comments, Senator?
Just want to thank the committee for hearing this bill and all the witnesses, and I think it is a very unique bill where we have so many healthcare providers, our nurses, our physicians coming together. As I mentioned, certainly want to consider this being voted out consent, and happy to talk to you all after the hearing.
All right, thank you so much, Senator. All right, I think that concludes. All right, yeah. All right, I'm going to make the motion to adjourn. Can I get a second? Second. Thank you, Senator. We're adjourned. Hit the gavel.